Gabriel Patino here at the Cosmetic Surgical Center of Costa Rica. We're going to do micro-part-assisted liposuction to the entire back and a fat transfer to the buttocks. We're just starting now. The patient is on her side. And what I want you to see is that this is a vibrating tool, very much like an electric toothbrush. So I'm going to let the electric instrument take care of it, right? Instead of me using it like an old toothbrush, going at full force, back and forth, and causing gum bleeding in the same manner. The fact that you have this instrument doesn't mean that you're going to use it properly. So you can use this same instrument and go back and forth and cause bleeding and damage. But we have a bloodless technique here that I developed since 2000. How comfortable I am, I'm very relaxed, we're going very slow, we're not sweating it. We don't do many patients, we just do one patient at a time. And this is just incredible. Thank you. Yeah, so this is the oilless, bloodless fat graft that's going to go into her bottom. So much less risk of anemia, much less risk of bruising, much less risk of postoperative pain because of the numbing medicine. But very importantly for the buttocks, much less risk of oil cysts. Why? Because we're not putting oil. Much less risk of blowout fractures. Why? Because we're not putting any blood in there. Thank you. Okay, so look how we gave her a nice hip. Remember how this was like that? She had a lot of rolls on the back. And now these are her buttocks. We're covering them for social media. And I'm going to show you the waist area and what we call the pinch test, right? So if I go like this, see? Look at the pinch test. This is where basically all over we go is 0.5 centimeters, see? Look at this, see? 0.5 centimeters everywhere we go. You see that? Everywhere we go here, 0.5 centimeters, you guys, see? See? Look at that, see? 0.5 centimeters. This is what we call the pinch test everywhere we go, see? And I can do it this way too, so you can see that it goes on both sides, see? On both sides, you see? Look at that. This is beautiful. 0.5 centimeters on all sides. Beautiful. Thank you. Wow, so she's on the other side. Notice the difference. See how this other side, this is her waist. We finished the waist like that. Look at the waist now. And I want you to look at the output. How bloodless, oilless, beautiful is that fat graft that we are showing you right there. And this is just a different technique, you guys. If you see that what the surgeon is putting into your buttocks is pink or red, so this is just a different technique. And some surgeons, what they do is they get the bloody output and then they process it with different fat graft cleaning systems, you know. And that takes time, and it's not going to give you this beautiful yellow aspirate. Impossible. Thank you. And you know, it's basically a unique technique, you guys, so you can watch your surgeon and watch what comes out. If what comes out is like this, okay, that's very good. But most of the time, we're covering the buttock here for social media, but most of the time when surgeons operate, all this is red. And so what we want to show here is that this is a very fat graft that's going to go into her buttocks, and we don't process it with any processing system, and that saves us time also. Thank you. Wow, so look how slow I go, how beautiful this fat graft is. And the reason why we don't have to wash it and process it in any way is because it's clean to begin with. It's beautiful. Thank you. Wow, so in addition to that, I'm not sweating the procedure, and the reason why we don't process the fat with any available commercial systems, which the people have come to demonstrate here without any success. Why? Because they cannot improve this fat that's already beautiful and bloodless. What are they going to do? Thank you. But this is a special technique. It takes a special surgeon to do this. You have to be, you know, very respectful of the tissues, very attentive. I use both hands so that it decreases also the risk of injury to the surgeon as well, but more importantly, it decreases the risk of organ perforation. I am ambidextrous, but if you're not, and you're doing this procedure, it will force you to go slow. Thank you. Yeah, so let me explain a little better. So I'm ambidextrous, and most surgeons are, but if you're not, if you're a surgeon out there and you're not ambidextrous, try your non-dominant hand, right? Because it's gonna force you to go slow. When you go slow, you're gonna have a better chance of getting this beautiful output. It's like driving on the freeway. If you go too fast, you may go to an unintended area and perforate an organ. That usually happens to a very tired surgeon, perhaps on a Friday afternoon after doing maybe 10 or 13 patients. Yeah, you're gonna be tired. You wanna be going at full speed, and you may go into an internal organ, an unintended area, right? Something that has never happened to us, thanks to God. Thank you. We're done with this other side. This is the buttocks over here. We're covering the buttocks for social media. Look at now the waist, instead of being like that, it's like that. And this is the pinch test, right? So I'm gonna show you the pinch test on the waist, see? This is 0.5 centimeters here, you see? See, very nice. You see that? I don't know if you can see it that way. Is it better this way, like that? See? You see it better like that?
Yeah.
Yeah. Better? See? Better? See? This is it. Thank you. But I even it out a little more. I got more out. See? So now look at these. 0.5 centimeters all around. Look at that. See? 0.5. Very even. Very beautiful. So we do these pinch tests, you know, to improve. This is the final details, right? And when we go like this, you can probably see it better when we go like this. See? Maybe get closer this way. I don't know. You can see that? Can you see that? So this is a 0.5 centimeter everywhere you go, you guys. And here's the same thing. See? Everywhere is the same. Thank you. Alrighty, so notice the high definition in the back side, the paravertebral muscles. You can see that we gave her some high definition here on either side. Thank you. Yeah, and I'm also creating this line in the middle where the vertebral column or the spine is. See? Nice line there. See that? That's how she's gonna be. Very nice. Thank you. Dr. Patino here at the Cosmetic Surgical Center of Cerrito. We're doing ultrasound guided gluteal fat transfer, meaning that I'm looking at the patient, I'm looking at what's going in, this bloodless, oilless fat graft, and I'm looking at the ultrasound to make sure that we put this fat graft where God put it, in the deep subcutaneous space with maximum safety according to the World Association of Gluteal Surgeons guidelines. Thank you so very much. Wow, look at the most beautiful, oilless, bloodless fat graft that has not been processed in any way. This particular fat graft has not received nothing. It was collected in 500 ml of saline and that's it. And this is just unbelievable. No commercially available things to clean the fat graft or anything. This is how we took it out and this is how it's going in. So she's going to have maximum fat graft retention because it's pure fat what she's getting.
Doctor, can you talk to us about what you're holding on your hand there?
This is the ultrasound. So this is for me to make sure that the fat graft goes in the deep subcutaneous space and not into a blood vessel, which could be fatal. We never had anybody die. We want to keep it that way. Thank you.
Thank you.
Hi, so we're going to do the ultrasound guided gluteal fat transfer, and this is the ultrasound showing the picture of the patient and where the fat is going to be. Up here is the skin, and right here, this line is the superficial gluteal fascia. This is Dr. Patino's cannula, which is the bright line there.
I'm going to wiggle it for you. You can see it. Okay.
And then down here is the deep gluteal fascia, which below that is the muscle, and we don't want to put the fat there. So we're just making sure we're in the right space.
And point to the tip of the cannula right there.
The tip of the cannula.
And watch the fat graft going in.
So as he's putting in the fat, it's getting a different grayish color, the cloud right there. And it's moving the space down, so it's creating a bigger space as the fat goes in. Thank you.